My name is Randy Ruda, and I serve as the Chief Executive Officer of the National Health Council. Here at the National Health Council, our goal is to provide a united voice for 160 million Americans living with chronic diseases and disabilities, as well as their family caregivers. Comprised of over 160 national health-related organizations and businesses, we strive to increase access to affordable, high-value, equitable, and sustainable health care for all. As we all start to get back to normal life after the COVID-19 pandemic, it can still be challenging for individuals to determine their personal risk levels relative to COVID and keeping healthy. The National Health Council stands committed to ensuring all patients have access to reliable and up-to-date information about their health and risk levels. Today, we're excited to share our Trusted Messengers video series. So this discussion will focus on women's health and its connection with the COVID-19 pandemic. With this information, we encourage you to talk to your trusted healthcare provider for medical advice and to make your COVID plan. So let's get started. I've got some questions for you. What do we know about the impacts of COVID-19 as it relates to women, maybe different from men? What can you share with me in that area?
You can go first.
So I'll go first. Later diagnosed, maybe not paying attention to the signs and symptoms, or we're so busy taking care of others, we don't realize how sick we are, so we finally get that positive, but it's already, COVID has taken over.
Wow. Susan, is that kind of what you've seen from the FDA's perspective?
Yes, consistent. And then we should just think about some of the things that are challenging for women generally, right? If I think about when vaccinations became available,
That's right.
I made sure that my kids got vaccinated and my husband was vaccinated and all the friends and family, and I need to schedule mine. And
It's
Of
always
course.
the story. Always
right?
the story.
Right?
Always.
And then, I got in line, got it done.
One of the things is that the official public health emergency has ended. And I think people have been aware of that. And so what does that mean? It doesn't mean that the risk of catching COVID or experiencing things goes away. Maybe some of the supports have changed, and I know we're actively working to make sure those supports are around not just women, but everybody. But what did you see? Did you see any change in perception when the attention to the public health emergency coming to an end occurred?
I'll let you kick that
Yes.
off.
Yeah.
So
You might
I
have some
think-
personal insights on
yes,
this.
certainly, right? Then you have people saying, okay, the public health emergency is over, I'm safe. That's actually not how the equation works, right? The public health emergency is over in part because we have better ways to identify, protect against, and treat COVID-19. It's because we've made these advances. And it's more about how the government responds to COVID-19 than it is the actual risk to the individual.
Right.
And so we have to remember there are two different things. We kind of equated them with there's a public health emergency and I need to be careful. I still need to be careful and be paying attention. Am I exhibiting symptoms? Am I not feeling great after having been at a concert, right? Been in an environment where I'm exposed to a lot of people? Well, then I should take a test. And if it's positive, I should try to get access to the medication.
We've got more than 160 national health organizations that are part of the National Health Council. One of the clear learnings that we've heard from our membership is that COVID and the pandemic brought to light the mental health challenge that may have been there all along, perhaps, and just not acknowledged, or by virtue of isolation or really feeling stress because of this threat of disease. Did women maybe experience that slightly differently, or
I would
what
say,
did you observe?
Yes. So from market research that Healthy Women has done, we definitely have seen more anxiety. Like you were not normal if you weren't overstressed or over anxious. The women were at the forefront trying to figure out, do the vaccination thing, and then having someone go into the hospital. And I can share, I was floated to a med-surg floor that was now a rehabilitation floor because people that were in getting, for operations weren't able to be sent home. So what I saw is, just trying to have contact with some of your loved ones was so difficult because they weren't used to using mobile phones or iPads.
Right.
And so the hospital would set them up with iPads, but they didn't know how to use them. And so who do you think that all fell on? It's just like not only were you trying to run your own household, you're also trying to manage the care of aging
course.
parents or loved ones.
Describe, are there other aspects of a risk profile that women have in this space that we haven't touched on yet? Susan, you look like you have a thought.
Yeah, so I think one of them is that women are often in roles where they have a lot of physical interaction with others, right? So they may not be in a bedroom on remote video calls all day. They're caring for children, in a nursery school or teaching in a school, or as healthcare professionals, doctors, pharmacists, nurses, or in retail settings. Right. And so that's just a reality we should recognize, not only for women and men, but all of those professions where you have that physical interaction, you have more risk than you do in a remote environment.
That's right.
Right.
And then those women that are living with chronic conditions that may be living on their own too.
Yes.
I have one aunt of mine has COPD and she's on oxygen, but very independent. And so she really just adapted and said, I still want to go grocery shopping, but I'm going to go at 7 a.m. Remember, how all the grocery stores had they open early, but would have it for high-risk people.
Right.
So, I was just so proud of her for doing her, and just really putting strong protocols in place, would wear gloves, wear her mask, go at 7 a.m., get her groceries, and then come home and not go out.
Yeah, absolutely.
And what I like about that plan, and then we can think about it today, you adapt it to what your experience. When my family travels, my son and I put on a mask. My husband and my daughter don't. And then what we all do when we come home is we test. And that's how we
become part
manage
of your routine,
it.
then,
Right,
yeah,
right.
sure.
But it's I think about what I like about that is that we've settled into what makes us comfortable and recognizing that might be different from a decision that someone else makes.
Sure.
But what can I do that's in my control?
One thing that also became very apparent, not just to the Health Council, but to, really I think everyone in America, is just how different the experience of COVID was for different populations. And my perception there is that there were underserved populations that have been traditionally underserved, maybe disconnected from healthcare for different reasons. And it seems like COVID really exacerbated and made clear, like in the mental health space,
Sure.
made clear where those disparities, where that lack of equity and access exists. You're both nodding. Tell me a little bit about what you observed around underserved populations.
Well,
And then women, particularly in that space.
Right. Well, in many of those environments, their jobs couldn't go remote, right? So they were still in an environment where they were going to be, having physical contact and thus inherently exposed, and then come home and maybe living in environments where there are more people in in wherever they're living and having additional responsibilities. I think that there were inherently more risks, and then if you have chronic conditions, you're also just, maybe you weren't in the best shape to begin with, and then have greater exposure, then to get COVID-19.
Right.
And then even, looking at living conditions and, maybe not having that support person. So if your child's sick, the mom's going to be the one that's taking care of them. So they're not quarantining properly. And again, not everyone had access to being able to quarantine. I mean, that was hard on people that had extra hands, right? Let alone people that may not have the living conditions to do the proper quarantine or just did not have the extra hands to help them during that time.
Right, and so you're at that exhaustion level with the infection and then still needing to discharge caregiver duties, which maybe gets back to maybe part of our plan is doing more to take care of ourselves up front.
So talk to me a little bit about that dialogue with the healthcare professional, the person that you rely on to give you that good information. I would assume that your organization probably has some, 5 questions to ask as you go. What kind of guidance have you seen be useful to women to know how to even approach that appointment with their doctor, with their nurse?
I love that question because it's giving consumers or patients the permission to have the conversation, right? And so we give them guidance. So, you know what? I've had COVID. I had COVID in the past 6 months. I was not vaccinated. So you can share like whether you were vaccinated or not, because don't assume that they have all your information in front of you. And I think that's one thing that we all do is like we assume. So don't assume, share, whether,
Right.
if you've gotten vaccinated, if you haven't gotten vaccinated, if you've gotten partially vaccinated, or maybe you've gotten boosted and you still tested positive and are not feeling right. Describe your symptoms.
Talk a little bit about the role of information and how women in particular may access information in support of their own health, in support of their family's health. And is there misinformation in the environment that we should be aware of and concerned about?
So let's do a little bit on misinformation.
Okay.
And then remind ourselves, it's not new, right? Misinformation is really, we may just be wrong. And then we share that wrong answer really broadly and loudly, not in malintent, but we're just wrong. And
Or a celebrity shares the wrong information.
Right. And so that's where it's just good to think when you're looking for that answer to be discerning, right? And think, what are the sources that I trust? And then to test the information. If there's something that you only see or hear in one place or from one speaker, okay, then think about that. What should I think through?
Right.
Who's contributing to the information? And then ask questions. It really is okay to ask your nurse, to ask your doctor, to ask your pharmacist, and say, I read this. Is that right? Or what do you think? And to really kind of continue to seek information. I think maybe where misinformation is most damaging is when we assume it's the right answer and we're not open to kind of seeking additional information, or when we hear something that is contrary to it, it doesn't make us think and say, I want to look a little more.
Right.
I agree with everything that Susan said, and I think there's some really trusted, when you're going to a website, you want to go to a website that you know has trusted, medically vetted information. If you're looking for health information, make sure that you're going to those medically vetted sites that you know healthcare professionals are reviewing the content's updated on a regular basis, and there are some great sites out there.
Absolutely. Well, including sites that you would have for your own organizations or, as trusted messengers. I mean, that's why I thought it was so important for you to talk with me and with our audience about women's health, because that's what you know so well and can bring that perspective forward. So maybe talk a little bit about your own organizations, and for people that are listening in with this session, women in particular, what would your website, what would your pool of information? I know you've got a whole network of communicators on this. What
we do.
What should we call attention to?
So with healthywomen.org, we look at all women's health from head to toe. And since we're looking specifically today, our conversation is focused on COVID and the importance of taking care of you. You want to look at vaccines, right? So we've got a great vaccine hub. We've got the schedules that you should be following from an ages and stages approach. We've got great questions that you can begin that conversation with your healthcare provider. Whether you still haven't gotten the vaccine, that's okay. Maybe this year is the time that you feel comfortable in getting that vaccine. If you're ready to get boosted and you're confused, we've got questions for you too. And the importance of taking someone with you, if you can, to that visit. And if you're not able to get in to a visit in person, opportunity to use telemedicine, and we can walk you through how to set that up and use that. So what's also great about Healthy Women and the organization that I built is that we partner with all the organizations.
You do.
Like your organization,
which is
like
great.
your organization. We are in it together, and we want to make sure that women have access to all these great organizations that are doing unbelievable things, including having great support groups. So we make sure that women have that access 24/7.
Yeah, I mean, that is a terrific resource. Susan, I know your organization is a collaborator, has information to share.
Yeah, so because we are working to help the FDA do a better job, right? We have very discrete projects, but one of our core activities is to help improve the public understanding of FDA and the products it regulates, because then it's easier, and then you can say, okay, how did that vaccine, what did the companies have to do to investigate their vaccine, to show the evidence, and then to monitor it, right? It's just a reality that every vaccine, every drug, every device that comes to market in the United States is then monitored until it comes off the market, right? That we keep trying to learn about it. So if you go to reaganudall.org, there will be resources that help you understand what it is that the agency is doing. We have a way to look for investigational products. If you have an illness that there isn't yet a product that's approved, we help you look at what clinical trials are available, and then really look at very discrete topics, whether it is, we did a lot on the COVID-19 vaccines, but providing a safe space to look for answers to questions. And I have to say that the FDA website is actually quite good if you can get to the right places, so search carefully, but FDA.gov has really good information. And if it's too dense, which I'll admit it sometimes is for me, there are also then places like your organizations to translate it. And so that's, I guess I'm back to keep seeking information, right? Look for the answers, because there is good information out there, and then ask questions.
So this is so exciting to have you all share your expertise, your insights in this way. And I really see kind of a call to action for all women in terms of talking to their clinicians, having that plan, which then does touch on some of these other ways in which you keep yourself informed, ways in which you help your family stay healthy. Well, thank you both very much for joining us today. I hope that this has been interesting to all of you. It's really vital to your own health, to your family's health, and really for keeping our communities safe and healthy and productive, leading the lives that we really want to lead. So thank you all.